Great. Welcome to another great webinar for the CSE Development in Action webinar series. Today's webinar will be on resilient innovation, building health tech the African way. And I'm pleased to invite the speaker for today's webinar, who's Stephanie Okpere, who is the head of design for health practice for Co-Creation Hub, which is Africa's largest innovation hub focused on health, education, economy, and technology. I will let Stephanie talk more briefly about herself and her work. But before we begin, I would also like to let you know that Stephanie is a 2015 Commonwealth Distance Learning Scholar from Nigeria, and she completed her Master's in Public Health and Primary Care at University of Manchester. So, Stephanie, before we begin, if you would like to introduce yourself, give an overview of your webinar presentation, and start off with the webinar. Over to you.
All right. Thank you very much, Eva. And good afternoon, good morning, good evening, depending on where you're joining from. My name is Stephanie Okpere, like rightly said. I currently work with Co-Creation Hub. It's a Pan-African, actually the largest Pan-African innovation ecosystem enabler. And I've actively worked within the innovation space in Africa for the last 12 years. I'm excited to be here amongst you all as one of the alumni beneficiaries of the Commonwealth Scholarship. And so it gives me great joy to be able to share some of my experience and also share insights from the innovation ecosystem and key happenings as it relates to health, and also how to ensure that health solutions are better built for Africa, ensuring that they are resilient and sustainable. And so starting with the topic that we have for today, which is essentially resilient innovation, building health tech the Africa way. During these conversations, we'll look at the Africa health innovation context. We'll look at key drivers of failures within the health tech innovation space. We'll look at a few case studies, and then we'll look at key recommendations. And those recommendations will also be based on some of the case studies that we'll be exploring. We'll conclude with a few points, and then I'll be happy to take any questions that you might have. I'm happy to share my link, my details with you all to find out more about my professional experience. However, for the purpose of this conversation, I'm happy to move this forward quickly. Pardon me, I'm not very used to introducing myself or talking about my related experience, but I'm happy to provide information on that as we go, right? All right. Regarding my current work, just to highlight, and the reason for this is also to help you understand the interactions that I currently have with the innovation ecosystem, and why this positions me to be having these conversations with you all. So I currently work in an organization that has, directly invested about 10 million USD in startups across Africa. We currently are present in 5 countries: Nigeria, Rwanda, Kenya, Namibia, and Togo. And we've supported some of these startups to attract up to $154 million in external fundings. The work that we've done have resulted in about 48,000 indirect jobs and 12,000 direct jobs. And our work currently extends into about 40 African countries. The focus for us is really to advance the application of social capital and technology towards advancing Africa's prosperity. And like Eva rightly said, we work within education, health tech space, and the creative economy space. But I lead the work that we do within the healthcare space in Africa. We've worked with several partners: Meta, the African Union, uh, in a good number of them. You can see some of their logos on the screen. Um, my work entails research, market intelligence, advisory support for startups, accelerators, and incubator programs. And a key component of that work is also the health workforce capacity building, where we understand that adoption is, significantly important. And for us to be able to achieve that and allow innovators, scale their solutions, the health workforce must be ready, digitally literate, and also have the various skills to be able to utilize and adopt the solutions. We believe that innovation, I believe personally that innovation does not thrive in silos. And so community and ecosystem building is very important. I lead teams that build communities around tech innovations in health, bringing together investors, bringing together the academia, the funders, the donors, the non-governmental organization, governments, decision makers, around the innovations that we build as a way of ensuring that there's the right partnership and collaboration to ensure that it thrives. On the basis of that, I've worked on the national task force, like the COVID-19 national task force. I've supported in designing digital solutions that have been used at national level for vaccination tracking, for example. I've worked with several startups across the African country, providing advisory service, business related support, etc. Just to mention a few of the work that we've done. I'm very particular about building solutions that actually move the needle, not just beautiful solutions, but solutions that are actually built to solve the needs for the communities. And in Africa, where there are lots of challenges that we still need to address, it's really important that technology and innovations are used for the right purpose and to really solve the right problems. We do not have the luxury of having failed solutions. And that's why the topic for today is particularly interesting and important to me, to be able to support and provide information for, scholars as yourself to be able to design and develop solutions that have the potential to actually scale within the African continent. We consider Africa as a very promising certain for tech innovation. And why is that the case? We've seen significant growth in investments and investments coming from across the globe, coming into Africa. In 2020, we had about 6.2 billion US dollars raised in Africa. However, that number has, we've seen it reduce and increase over the years. But it's starting from zero a few years before, almost zero a few years before, to having that number is actually a pointer to the fact that investors are beginning to understand that Africa is ripe for investments. We have a youthful and large population, and what that tells you is that, there are young people with entrepreneurial skills. In short, some research has shown that about 22% of young people in Africa are actually involved in some sort of startup or the other. Again, it's also a pointer to a large customer base, about 2.3 million, 2.5 trillion consumer market is what it's estimated to be by 2030. I would say that that's business, that's population, that's consumers that can actually utilize innovative solutions. There are limited legacy solutions, which means also that there's limited competition. There's enough room to leapfrog. I mean, in several countries in Africa, you can come into communities where certain things are still at paper-based level, right? For example, most health facilities in some countries are still collecting data on paper. Imagine introducing a solution that can move communities from paper-based data collection all the way to digital data collection and to support them to become, to be able to connect, intersect, and ensure that systems within those communities are interoperable. That would be a significant leap for such communities. But that also provides a huge opportunity for the startups involved. There's also opportunity across sectors. And I wanted to highlight the fact that, across Africa, we're still importing foods of up to about $60 billion. And so that's an opportunity for agri-tech. Even tracking that data and helping to providing it for effective decision making can be in itself a source of a way of generating income, and innovative solutions are also required there. We're also seeing a number of African countries, up to about 20 African countries now have some sort of policy relevant to innovation, technology. And so there is increasing number of policies such that with the right policy environment, the likelihood of your solutions thriving also exists. We're also seeing governments investing in digital public infrastructures, right? We're having NINs, National Insurance Number, digital solutions for payments, etc. And, certain databases are also being built across countries that would provide, opportunity. Once you connect with such data, you're able to do a lot of things, financial inclusion, get data, assess your risk, etc. There are lots of opportunities there that are still very much unexplored. And so in general, with all of the projections in place as to what the Africa healthcare market and the African market in general would likely be worth. And I like this projection based on IFC in 2023. There's a projection that the Africa healthcare market will exceed 259 billion US dollars by 2030. That's a pointer to an available market. Even though those opportunities exist, like I have mentioned, challenges still persist. Over half of Africa's population cannot access essential health services. There are significant health workforce shortages. And the word, for example, jakba, which is a Yoruba word for travel, has become significantly popular in Nigeria, for example, and across several countries, not just because of the huge number of people who have migrated out of Nigeria and also several African countries, but you see that word also come up often in key meetings, interactions within the healthcare space. And one of the key questions we continue to ask is how can we ensure that we have sufficient, we can address the challenges with access and ensure that people, especially those in rural environment, can at least access medical practitioners. You can imagine having 3.6 doctors per 10,000 people compared to that number, compared to about 29 in Europe, right? The need exists. Solutions that can help bridge the gap, leverage health personnel where possible to reach more people without necessarily moving from one point to the other can actually help save some more lives. We also have fragmented systems, data being developed, collected in silos, different systems working on different kinds of platforms and not necessarily being integrated or even, optimized for that purpose. And so we also have a growing middle class. And with that, there's continuous demand for improved healthcare services and even private care, giving more opportunities for business to business interactions and models, and then business to consumer related opportunities. I think we've set the context quite well. We do have some solutions working, or innovative solutions working here in Africa. Data from Silent Advisory in 2023 pointed to the fact that there are about 1,000 health startups already working across Africa. But the challenge, however, is that only about 10 to 20% of those startups can actually scale. Between 10 to 20% of startups actually scale beyond their pilot. So a lot of the startups and innovative work we have coming out of Africa as it relates to health tech are mostly in the pilot phase. There are several reasons why they remain in the pilot phase and in that valley of death. However, today's conversations will be centered around why most of them actually fail. Um, and so we generally also rely on technologies from the global West. A lot of the time, a number of African countries have explored importing some of those solutions. While some have thrived, some have failed. And so we'll be exploring the reasons why some of these solutions have failed. And we'll be looking into some of those that have succeeded. And we'll be trying to answer the question, why? What are the factors to consider when setting up your solution for Africa? And what are the factors that could likely lead to failure? So let's talk a bit about why some innovations have failed. I would summarize them into these factors, although there are several others, but I believe that these are very important and are aligned with some of the interesting case studies that we've seen within this space. One, funding instability, high operational and logistics costs, inadequate regulatory alignment, mismatch with market readiness, governance issues, and infrastructure constraints. Let's put it in perspective by looking into um, some of the startups that have come into the African markets. I would talk about briefly using Babylon as a case study for one of the innovations or startups that came into the African space but failed. And the reason for Babylon's failure was mostly as a result of financial challenges. For Babylon in particular, the version of their solution that was built for Rwanda was actually called Babil Rwanda. It's a telehealth and AI chat platform, and it was actually providing services to about 20% of Rwanda population. It had a good interaction with the Rwandan government, had some partnerships in place, and had even gotten a 2.2 million USD from the Bill and Melinda Gates Foundation for a 10-year contract starting in 2016 to provide services at a discounted rate to citizens or populations within Rwanda. So definitely certain things were done right. However, why did Babil Rwanda pack up? The major reason was as a result of financial challenges with the UK, US, parent company of Babylon. And that resulted in Babil Rwanda winding down. A lot care was cut off for a number of people as the BMGF funded project was still ongoing. There are conversations around, selling off Babil Rwanda to some other company. However, that did not essentially pull through. There are also several other concerns, although the major reason why it failed was because of the funding, the collapse and funding challenges with the parent company. During its implementation, the implementation of Babi Rwanda in Rwanda, there are still some other challenges. There was the assumption that there would be reliable internet connectivity, which was certainly not the case, and that's impacted on service provision. The way payments are made in most African countries for healthcare services is mostly out of pocket. Insurance coverage are usually very limited. Really, most times they cover less than 30 to 40% of the population. And so those sorts of payments and reimbursement flows are not as straightforward as you would find in most of the developed countries, or should I say in the global West. And then they had also introduced the AI diagnosis model. At the time, policies around that were yet to be developed. In addition to that, they were leveraging services from personnel even beyond the country, considering that this was thought to be a Rwanda national project. There was a lot of questions, a lot of concerns regarding where the data of the citizens were going, who's utilizing them, to what degree is the platform really engaging local healthcare workers. And so there are lots of concerns that point us to some of the things that Babil could have gotten right, Babil Rwanda. So let's look at what the recommendation is as it relates to Babil Rwanda. I had the opportunity to participate in the disruptive strategy course by Clayton Christensen, late Clayton Christensen, that was really focused around disruptive innovation. Although telehealth may not be considered disruptive at this time, I mean, from the global perspective. However, in Africa, especially when we look in the context of Africa and Rwanda as at 2016, the introduction of telehealth services could definitely be thought of as disruptive. The fact that the system was largely paper-based at the time, right, which it is not at the moment, was largely paper-based at the time. And the tech solution essentially was going to allow for more patients to be reached, but also going to move up to 20% of the population to a particular solution. And from that training, one of the key things that stuck out was that whenever you think of introducing a business that is disruptive, and a parent business already exists, an established company like Babylon already exists. One of the early principles that founders need to take into consideration is the need to separate both entities. The leadership, the implementation approach, the processes, they need to work independent of each other, right? Even the leadership, because the thinking around implementation for the solution in the West and the solution in Africa is really different. And so you need to work with people who are open-minded, who are exploratory in nature, who are interested in, first of all, understanding the terrain and building based on that terrain, rather than working based on structures and systems that have already been built for a different process. And I would say that that's one of the key challenges that existed in this case, resulting in business shutdown and financial institutions, financial challenges from one company impacting another. It's important that the business model for the new one is different, sustainability plan is different, etc. Should they have been addressed in such a way, Babi Rwanda might still be running. There were other challenges, and we'll talk about them as we go. But for this particular one, I really wanted to point out one of this key principle as it relates to working around disruptive innovation. And I encourage everyone to, research about Clayton Christensen. He did some very important work and research about disruptive innovation. Coming to Africa, a lot of work you might be interested to do might be disruptive based on the stage of growth that we might be in within, or that we are in within the healthcare space. Okay. I want to spend a lot of time today talking about what worked. Although there are lessons to learn from what's failed, I would quickly summarize on this slide some of the things that have failed over time to give us some time to explore in more detail what has worked. And so over time, in general, some of the key drivers of failure that we've seen is infrastructure mismatch, right? In Africa, a lot of time you need to give consideration to low-tech, offline first designs, especially if you're looking to scale across countries, including rural or last mile communities, right? Building systems on cloud-only platform typically may not work across board, right? In addition to that, it's very important to understand what the payment systems and cultures are within the local environment. As I did mention, a lot of people pay out of pocket. And so coming into the country without really understanding how that system works for each country, or coming to Africa without necessarily understanding how it works per country, what the culture of the people is as it relates to paying for healthcare service, their purchasing power, their willingness to pay, it could be difficult to actually come up with the right payment model for your solution. Blended financing is one of the ways that most startups have thrived in Africa. And so a lot of the time, this could include funding from donors, typical to what we saw with Babio Rwanda, to cover a percentage of payment. In some instances, it could be funding from government to cover a percentage of payment for the patients that you likely be seeing or for your clients. In addition to that, you might need to also get an insurance company to cover the low percentage that they can cover, and then also design systems or integrate with financial fintech solutions that allow for easy payment for your end users. This might differ, the implementation might differ from country to country, but those are some of the things that you need to take into consideration. Regulatory friction. We saw this with Hello Doctor. Hello Doctor was also a medicine sort of platform, telehealth sort of platform. However, there was no close interactions with the key associations for health within the country. And as Hello Doctor started to take on, clients, etc., some of the members of various associations started to get very uncomfortable regarding the shifts in service from the typical visit your hospital and get service from patient to really having some of these platforms work in the space. And so, there are uproar, and because there was no regulation in place at the time that aligned with services being provided by such a platform, there were concerns, and eventually the Hello Doctor platform could not proceed with the services. And so it's very important that you're conversant with the regulatory or compliance frameworks available within countries, and where possible, especially when they are non-existent, that you're involved in co-designing them. We'll talk about startups that are doing that and how that is helping them to succeed. There's also, we talked about funding dependence for Babylon Rwanda and cultural misfits, bringing in imported UX, designs that are user-friendly or interfaces that appear to be user-friendly in one clime may not be user-friendly in Africa. In some countries, language would matter. They need to be provided probably in the local language, even if they are English-speaking African countries, right? In some climes, in some situations, in some communities, you must take into consideration whether or not your end users would actually want this presented in English and how they would want to navigate through your application, right? In some communities, actually, there are also people who are skeptical about technology solutions, right? And so you need to think about what works for them and how to help them and how to build trust with them for your solutions. When those things are ignored, startups are likely to fail. Now, let's talk about why others succeed. Can you just give a thumbs up? Can we have some people give thumbs up if you can still hear me? I just need to be sure that we're still together.
Yep, we can hear you.
So Eva, can you confirm that we still have?
Yes,
All
yes,
right,
we can.
fantastic. All right, fantastic. All right, so why do others succeed? Um, I would just highlight a few things from this, and I've provided a lot of detail here so that, if the slide is shared and provided to you, or, you can get a lot of information from it. But we'll look at them in detail as we go through some of the case studies that we are highlighting. One, your solution must be solving a key problem, a key pain point. There are challenges in certain continents that are not relevant to Africa. We must be able to ask the question, some things may be considered as just luxury, right? But your solution must be one that's really, really solving a problem, right? And you must consider that in some instances, even the end users may not yet be aware of their problems, right? And so there's room for sensitization. However, it must be a challenge that they fully understand. I've highlighted here replacing manual paper-based system with electronic medical record as an important thing. However, even within Africa, there are healthcare facilities where the managers would ask you, what's the benefit for me? And so you have to help them understand the benefit, including financial benefits of digitizing their processes, and then help them understand the losses they could be making, the leakages, and how an enterprise system that includes an EMR will be useful for them, and at what point they would likely start to make significant return on investment. If those issues are not well communicated and the benefits not well communicated, there's a challenge. Also, you need to take context into consideration when designing your solution. I've talked about the literacy level. You need to consider what's the literacy level, digital literacy level. What tools are people familiar with using? Are there connectivity challenges? What locations would likely be feasible to adopt my solutions or to utilize them as a result of the connectivity challenges? Would I rather use an offline system? Would we be able to reach the target audience or the target beneficiaries or target users rather by using those, solutions, those type of solutions? Again, when we think about pricing, it's always important that you're balancing affordability and profitability. Numbers that work in certain, continents might not work for Africa. I always encourage people to think about volume, right? And, think about profits that can be made based on the volume rather than think about increased costs or high cost and low volume. A lot of the time, high volume, innovations that can take on high volume at lower prices tend to thrive. It's also very important to take the B to B route and B to G route where possible, business to business. It gives you a higher volume of users. And across Africa, government is definitely one of the biggest customers or customer base that you can essentially have. So provides the biggest opportunity for your innovation to scale. It's also very important that you think about how to layer your services. You may start with one service. It could be providing EMRs, and providing that service might provide you access to data, relationship platforms, and networks. It's always very important to think about what additional service can I continue to provide to ensure based on the target audience that I now have access to, and possibly based on the data that can continue to provide additional value and where possible at even minimal costs, right? So it's always very important to think about how to layer services on other services. So let's look at, right, again, you must build relationship with actors in the space, insurers, health agencies, NGOs, governments. It's actually very, very critical that happens. Again, I've mentioned the over-reliance on foreign HQs or a single donor and build mixed finance. So I've talked about mixed blended financing approach. You must focus on co-designing, governance, licensing, data frameworks with regulators and associations in order to build trust. This will help you avoid shutdowns. Bear in mind that when you think about working in Africa, you must also consider that in some of these environments, there are actually no regulations in place yet for some of the services that you're looking to provide. As such, if you go straight in, like we saw with Hello Doctor, and provide those services, you may encounter challenges. And so once you've done your assessment, it's important to think, is this a policy safe environment for me to work in? Are there enabling policies? And where they are not, it might not necessarily be a reason to back out. It's a reason to co-design. and co-create something that might work for you. So when you think about coming to implement an innovative solution, especially a disruptive one in Africa, you must be willing to build from the ground up. I have some time to talk about one of the startups today that's very dear to me, that's building from the start up. That's also part of, one of the programs we're working on, the AI Digital Public Infrastructure Program, currently funded by the Gates Foundation, that has been implemented across communities and states in Nigeria. I'm happy to talk about that startup as we go on and the work that they are doing. But first of all, let's look at imported solutions that have worked. Imported first from the Global West, and then we'll talk about African-based solutions that have worked and scaled within the Africa economy across countries within Africa. First of all, Sprozo. This was founded in Cambridge in USA by an entrepreneur known as Dr. Ashifi Gogo. It's really a mobile product authentication system. It focuses on combating counterfeits. A number of you might be familiar with it. You have labels on products, labels that can be scratched off, or rather with stickers, labels with stickers that can be scratched off and would usually contain unique alphanumeric codes. And those codes you can actually text to toll-free numbers and receive information as to whether or not the product is authentic, the product with you is authentic or not. I consider that a very, very important solution, especially within Africa and particularly in Nigeria, where we have a whole lot of fake pharmaceutical products still making their way into the country. This actually allows for verification and validation. The business model that Prozo currently utilizes is one that works with customers, customers such as pharmaceutical manufacturers and FMCGs. And then end users are essentially not necessarily required to make payments. Payments are made essentially by the businesses. So B2B model essentially. What are the major sources of their revenues? Service fees for each of the product authentication campaign. 2, data. Data is generated and they're able to provide insights on verification patterns and regional product risk. They also provide enterprise tools for supply chain transparency. And this is what we talked about when we talked about layering. You provide your authentication platform, you get enough data, and you're able to provide information on verification patterns. Manufacturers will really want to know which locations, have you been getting fake drugs the most from? Which of our products are likely to be adulterated? Do we need to change the packs of this product? What systems do we need to put? So it actually helps them make better decision, and really providing that enterprise tool for supply chain also helps to improve that process as well. So looking more into this and really looking at how the system in Africa is different from what they have in the Western world. Just to point out to the fact that Prozel did not necessarily import the solution from somewhere else and started implementing in Africa. It actually took the time to do some groundwork, and you can see the result of that in the different ways that the solution is being implemented across continents. In the USA, you would find that the focus is on brand protection, and it's actually for luxury goods and the FMCG market, fast-moving commodity goods market. In Africa, however, where it is most needed, and like I said earlier, you need to identify the pain points. You might want to have this on luxury goods, but the key question is, what's the number of people that can actually have the purchasing power to gain your luxury goods, right? Can you consider them to be fast moving, for example, in Africa? And what product would actually give you the volume And where would the manufacturers really consider this to be a major need? Pharmaceutical products, definitely. In the US, it's app-based verification and web dashboard. In Africa, it's SMS-based verification. Definitely works. Low cost, works offline, accessible on feature phones. Brilliant. 3, focus on enterprise SaaS clients in regulated high-income markets. In Africa, the focus is on high volume, low margins, B2B services. And this is tied to public health and pharmaceutical sectors. Brilliant again. For partnerships in the Western end, the focus is on corporate and logistics brands. In Africa, it's governments, it's NGOs, it's regulatory agencies. Brilliant. Pricing strategy, premium pricing for the Western model, as expected. However, for the African model, it is cost-efficient model per product code, making this affordable for African pharma distributors. I would say that this is a brilliant blueprint that innovators, startups can essentially work with in Africa. Let's look at a startup that actually has expanded across or scaled across countries in Africa, Helium Health. Helium Health is one of the interesting and, really successful startups in Africa. Started off in Nigeria, currently active in Ghana, Senegal, amongst other countries. Already have over 10,000 healthcare workers working using their EMR platform and working across 5 health facilities. They were essentially founded in 2016, and all right, they essentially founded in 2016, and they focused on digitizing hospital operations and have explored both cloud-based and offline solutions. On top of the initial EMR solutions that they had built, based on data generated over time, they decided to set up to add on to that, the Helium Pay, and also a financing platform for revenue management too. Why is this important? Let me break this down. With Helium Health, as you know, and as their system, as Helium Health scales across health facilities and as their system are being utilized across facilities, they have a level of access to data of patients, the number of patients coming into facilities, the sort of medications that are being sold in those facilities. They're also able to see how much revenue hospitals are generating. And as such, they're able to provide health financing support. Based on the revenue generated, they're able to assess the potential risk levels as well as funding levels that can be provided, or financing levels, if I may put it that way, level of finance that can be provided to hospitals. And based on that, they were able to design financing models for hospitals. Today, they provide significant amounts of funding for hospitals, and they're able to track sales. Since they're able to track sales through their systems, they're also able to ensure that there are payments for the services that are provided by these hospitals through their systems. I think that was also a brilliant way to layer services on each other. They've been able to expand to several countries, Uganda as well, Senegal, Liberia, and even to the Gulf region. And one of the things that was interesting regarding the work they did in the Gulf region is that they acquired Medic Inc. for the services they are providing in the Gulf region. That's a pointer to the fact that they understand that the regions are different and the way service is provided across regions are also different. And so, having a different system tailored for that client is also very important. And that's something that I've seen as well with Helium Health. They've essentially replaced inefficient paper-based hospital systems. They've built both offline, low bandwidth, and affordable pricing. And like I did mention, based on data, they're able to offer credit and financing services. They have a B2B model, which is also encouraged, really focused on hospitals and not just directly to consumers. So they have volume because the focus is on hospitals who typically will have a huge number of patients visiting their platform. Like I did mention, 8Medical is the startup that I did mention that is part of the AIDPI program that we're currently implementing. This program is really focused on designing solutions for the last mile. And so I'm happy to talk a bit about 8Medical, not necessarily from the perspective of scaling, but to help us gain insight into the level of research findings that startups would need to do and how in Africa, plugging into the ecosystem may not take the traditional routes that you expect in other climes. And I think 8Medical is a good example. Forgive me that your slides might be a bit wordy from here on. But I'm hopeful that as we interact and discuss, we can highlight some of the key things that we can learn from 8Medical. So 8Medical is essentially an AI search triad and transport platform. It helps to really connect urgent and emergency medical resources to users in need. And the target is to do that within 10 minutes or less. They kicked off in Lagos State in Nigeria, and with the focus of expanding across Nigeria and into other African countries. But they quickly started to understand that there were several challenges. Agencies within governments responsible for providing emergency services, the hospitals, the health facilities, the ministries for health were not necessarily interacting as much with each other, and coordination within those respective agencies were really limited. There are lots of unskilled and underpaid personnel, and that also has an impact on their motivation to get their work done. While certain infrastructure exists, they were mostly underutilized. People really didn't know what to do, how to do it. So imagine having ambulances, having emergency response, systems and people, personnel who really don't know how to utilize some of the tools that they have and, how to, leverage them. Again, the political will for innovation and even innovation within the space was almost zero. Policies were also, outdated. And, adherence to such policies were not, systems to encourage adherence and compliance were not necessarily in place. A lot of people saw emergency care as a loss. People may be unable to pay for the service, even if we provide them. They really couldn't see the business opportunity in it. And, there was also a lot of financial related requirements to be able to move the thinking around the innovation within this space forward that was lacking. And so Ibukun Tunde Oni, who is the founder, was willing to take up the challenge. His background as a medical doctor proved to be useful. He had lost at least two members of his family due to preventable death, and he also had a life-threatening experience himself, and that's part of the reasons why he became motivated to take up this challenge. And so the focus was on fire, roadside assistance, and security-related emergencies. And his thinking was that almost all emergencies will end up as medical emergencies. So if we can address this, then we've addressed the most complex ones. And the likelihood that we can address any other one is almost 100%. And that's the thinking that led to the setup of 8Medical. To move this forward, he needed to understand how to connect the various personnel and actors within the space and to find a way for them to interact and also to encourage users patients and payers to actually participate. He needed to build trust. In short, I like the way he put it. He said, create trust. He also needed to achieve online connectivity and really consider whether an online platform or an offline platform would be more important, and how to ensure that systems can interact with each other, so that there is information as regards availability of beds, as availability of the necessary emergency response services, as well as medical practitioners in health facilities, especially specialists who can provide services. And there was a need to create awareness and help stakeholders understand and see the value. Like I mentioned previously, you'll be shocked to find out that certain persons are so focused on other aspects of the work that could be outdated and do not really understand the value of introducing innovation within the space and really what they can do with it, including government. He also needed to build community around the product and really create that shared interest to ensure that it works. And so one of the things he did was to look at each of the key actors within the space and to try to understand what's the interesting thing for them, what's the opportunity for them. And for medical practitioners as well as first aid workers, it was an added opportunity to earn. And as far as it emphasized earning, right, they were more interested. One of the key questions they also had, or key interest areas for them, is how can we get real-time insight into the existing referral networks and information on the availability of bed spaces in various hospitals. So if we're going to be on the van, if we're first aid workers, how do we know which bed spaces are available, where personnel are? How do we ensure that there's consistent referrals from various facilities to us to move patients when necessary? For hospitals, it was really, how do we earn? How do we find a reliable logistic partner? For ambulance partners and owners, they don't want to be running around, getting to different hospitals only to find out that there are no bed spaces or etc. So that data was also important for them. And they wanted to be able to ensure that their assets are effectively used and that they are earning consistently. For patients, is really to be able to have reliable information on what to do, who do I call, where do I go when this happens, and to be able to also assess timely and transparent response to their transport needs, right? We don't want ambulatory partners that tell us they will be there in 10 minutes and eventually arrive in 45 minutes. We want a way of tracking, of knowing where they are, of knowing the reliable ones that we can really trust. And here's where it gets interesting. With all of this information, there's also the need to generate revenue. And from his interactions with government and various stakeholders, he realized that the best entry point was not through calls or reports based on fire incidences, as one might think. Although there's there's a call center number that, again, is not popular. For example, in Nigeria, that people are supposed to call, those calls usually don't come true because a lot of the people do not even trust those numbers. And so it wasn't the best entry point to say, oh, let's popularize a call center that people already know exists, but still don't trust. So how do we start in such a way that they can make profits, leverage on that profit to enable systems and build solutions, and then build from there? And so the entry point was the event industry. They had identified that about 30,000 events happen in Lagos State every month, which is about 1,000 events per day and 40 per hour. The event provides a large concentration of people. Our African and Nigerian weddings are usually almost like a carnival. And so there are lots of people already at those venues. So publicity, visibility, etc. is easy. And if you're looking to provide communication or create awareness about something, you can reach a lot more people there. It's a requirement. It's expected that when large events are being held, there's some sort of there's provision to address any emergencies that may arise. And so there should be an emergency response system in place. Although there were outdated policies around that, nobody was working on ensuring compliance. He saw that as a segment of, the services that he can provide that really had low barrier for entry. And so he started to provide services first as vendor. There are no rules, there are no laws, no guiding, no regulation in the industry. But as he engaged with the industry, he was able to generate data around the number of events taking place, where they are most likely to be taking place, etc. And based on that data, he was able to go back and then work with governments. And then work with governments to design policies, right, for events happening in Lagos, collect that data, and then use it to inform policy development. He worked very closely with Lagos State Safety Commission to identify and digitize the event centers in the event industry. He also works with health facility monitoring and accreditation agencies to identify and digitize the ambulance industry, which actually allowed for the onboarding of ambulances to even his own platform, right? And so he's providing this support and services to generate income, right? But also able to work with government to then design policies that create a friendly environment for him to deliver his service. Based on this, and as he continued to design the platform, and from interactions with end users, he was able to understand that the needs that they have. And so the system is now being developed, or has been developed, to actually provide the following services. People can come on the platform and book for ambulatory standby, and this is for events and emergencies. And, risk mitigation strategies that involve setting up emergency response systems around the event. There's also ambulance response, really connecting individuals, which HMOs and corporates, to ambulances, because a lot of corporate organizations are connected to HMOs, provide health insurance for their for their workers in the formal sector. Ambulance transport, when individuals book for this themselves, HMO, and then connection to hospitals. Afterlife ground transport, really connecting families of the dead to morgues and burial grounds. And then urgent care, connecting medical personnel to users in need of non-life-threatening care, like nursing care, pharmaceutical care. These appear to be the low-hanging fruits, even though the goal is to cover more services. The idea is to layer. And so this became the primary sort of services that his platforms could provide. As of today, Aid Medical has gone ahead to build strong relationship with hospitals, public hospitals, private hospitals, several health insurers, various public infrastructure, like partnering with police, hospitals, fire stations, also partnering with various kinds of businesses like Child Deck, which is similar to what you call the Uber Eats. And basically, it's helping to ensure that meeting users where they already are. Okay, because the platform already has a lot of users, it actually exposes them to those users. For InDrive, for example, which is quite similar to Bolt or to Uber, they also have an existing partnership that allows for their services to be utilized should there be any emergencies on the road for them. They've also onboarded private and public ambulance provider to ensure that there is supply generation, right? In addition to that, they've established Nigerian training centers and have registered them to address the challenges regarding limited knowledge and training within the relevant workforce as it relates to government and other stakeholders as it relates to emergencies. Now, this is a startup that really wants to provide a platform that allows individuals to connect to the service and care that they need. However, to achieve this, they have to build this partnership collaborate with government, design policies, etc. Within Africa, your solution does not thrive in silos. You must identify the interest of the various stakeholders, work with government in some situations to design the policy to ensure that you can thrive, right? Build strong partnership around your systems and solution. Understand the low-hanging fruit and the biggest pain points and entry points. Enter from that platform and continue to layer services as you go. And I believe that 8 Medical significantly embodies those principles that I've mentioned. Key indices. As at this point, they have about 37 ambulances, including 2 police ambulances. They're with the reach of about 1.8 million people within the vicinity that these ambulances provide their services. They've so far received about 24,000 calls, completed about 19,000 missions, thereby saving about 17,000 lives. They have about 400 plus responders registered on their platform. They have data on about 2,500 facilities, including availability of bed spaces. They currently have about 60 partners, and based on the work that they do, at least 7,300 jobs have now been created. I would like to conclude by re-emphasizing some of the points that I've made that we've learned over time can actually ensure that startups innovating for Africa thrive. One is to ensure that you're addressing a clear pain points. Do not simply, try to implement the exact same solution that you've built for a different client or a different continent for Africa. Chances are that it would not work. Design based on the constraints that exist. Think about affordability, think about workflow realities, think about cultural concerns, think about connectivity, infrastructural challenges where they exist, and think about how to adopt your solutions if there are existing solutions that actually fit the context, right? Layer your services, get data, build trust, and introduce additional services. Consider B2B and B2G as they will give you more volume against B2C. Adapt to the market, understand the regulation, engage with the regulators, co-design regulations or policies with the regulators where possible, and be strategic about your data. Leverage them for insights and use them to build the next layer for your business. I will take a pause at this point to take questions, but just to highlight that I've also provided, where you can get additional data if you would like to read a bit more about some of the things we've talked about today and learn more about what's happening in Africa as it relates to digital innovation and digital health innovation. Thank you all so much for listening. I would hand over now to Eva.
Hi, thank you so much. And that was a brilliant presentation, Stephanie. If you can, we'll leave this slide for a few more minutes and then maybe go to the Q&A slide, but I'm happy to take a few questions now. Thank you to all those who have sent your questions via the registration form. So I'm going to start the Q&A session with those questions, but um, also apologies, we did run a little over time, but that's all right. We'll still take a few questions, but do send your questions in the chat box. Um, and as I've said, this webinar was recorded, so is recorded. So we will share the recording on CSE's YouTube channel. So you will get to see the recording on YouTube very soon. All right, Stephanie, if you're ready, I can ask the first question. So what are the best strategies to be used in the African context to embrace those innovations and become resilient to those changes?
Thanks for that question, Eva. Although we've answered that question in the course of
Yeah.
going through the slide and from my concluding slide, I would emphasize the need for partnership. right? Build communities around your solutions, understand the context, right? Utilize human-centered design approach when coming up with your solution. And, take a moment to look away from whatever solution that existed before, and have been used from another continent, and really, you know, understand the community and the continents that you're building for, before introducing any solution. It will really increase
Mm.
your chances of success. Yeah.
Yep. Thank you so much. And as you can see in the chat box as well, really positive feedback coming through for your presentation. So I hope you do
Thank
get a
you.
chance to go through this the comments. All right, moving on to the next question. How do you gather community support or involvement rather in such innovation, or is it completely driven by the innovator?
Right. From the discussions that we've had today, I have shown you an example of a startup that has essentially made the effort to build community around his solution on his own. Um, but as one that works within an organization that is really focused on driving technology innovation and social capital, and with the understanding that innovation does not thrive in silos, um, CCUp, for example, would definitely support startups in building those kinds of communities. And so
Mm,
my advice would be, if you're building a solution, look for a network, look for a platform that's already building around innovation and really helping to enable innovations within the continent. By being part of that, you automatically are thrown into a community of people that are very much interested, that can encourage peer-to-peer learning. It can encourage peer-to-peer learning. You can have master classes and training. You can have facilitated introductions to stakeholders that are important. I also encourage startups to join incubators and accelerators. It's an opportunity for you to work one-on-one with different kinds of experts to help you
yep.
think about your business and ensure that it's tailored, for success. So you can't build alone. That might be really difficult. Join communities that exist and help them build with you and let them build
Mm.
with you. Yeah.
That's really great advice. All right, so the next question is from the chat box. As someone who you did mention about your work spanning like across different countries in Africa, um, and this is from an alumnus who works as a medical officer and works with the Ministry of Health in Sierra Leone. Um, According to you, what are the processes involved to foster a strong partnership with relevant institutions in a country like Sierra Leone, for example?
Right. I like the fact that you work with government and, in Africa, and if I can use Nigeria and a couple of countries, Kenya, etc., countries that we've had the opportunity to work with. Even in Sierra Leone, we've had opportunities to look into health financing and considerations for diaspora financing for health. And a lot of the time you see similar trends across countries. The government systems are often very bureaucratic. There are, you know, differing interests across agencies. And sometimes it's really quite challenging to connect those dots. However, there is a need for a champion. There's a need for a champion, an agency that considers itself a champion. In Nigeria,
Mm,
for example, we're seeing the Ministry of Communication, Innovation and Digital Economy really working across agencies to identify the tech innovation components across board and really bringing them together through roundtables, through key high stakeholder events and engagement
mm,
events, discuss what the critical challenges are, and to work together in designing policies that work for the various parastatals, right? And so that sort of champion needs to exist. Um, I would recommend that as my very first recommendation. Again, when policies are being developed at the federal level, it's also very important that agencies are mandated to work together right, on critical areas like tech innovation. Once
Mm.
those sort of policies exist and agencies are mandated to work together, irrespective of how bureaucratic they may be, the likelihood that they will really interact is high. And finally, I would say that, you know, over time, and this might not be something that we're excited to admit, but over time, they say who um, provides the piper determines the tune. A lot of the health-related work in Africa are donor funded. And so donors themselves play a critical role. Because they provide funding, they also have the convening power. They have the power
Mm.
to stakeholders together and an agency together and help them to actually speak together, or rather to speak to each other. And a number of times one might leverage on that sort of relationship to bring about the interactions and influence the various agencies to really speak to each other. Those are ways that can be explored in your country as well.
That's amazing. Thank you. We'll take one more question, and then we'll end the Q&A session. Um, the audience or the attendees asking, I think that the place of policy in telehealth cannot be overemphasized. So, how do you ensure sustainability of startups in environments with no robust telemedicine policies? Has any of the thriving startups tried to influence or partner with governments to formulate locally sensitive and efficient telemedicine or telehealth policies that are incorporated into the local health laws?
That's a very good question. And I would say that in there's been some progress, and we've had champions again. Permit me to reference even the Nigerian context. The conversations around having a telehealth related policy has been in place for donkey years, and
Mm,
I'm very fortunate to have been in interactions with some of the key champions within this space. One of the things that have worked in Nigeria, for example, is the fact that stakeholders have come together to build associations. In short,
mm,
interestingly, next week there's a teleconference, telehealth conference actually happening. And by building these associations, they're able to come together and define what the requirements might be, drawing from policies from various continents. They're able to support governments in adapting those policies, right, to or regulations to our contents and providing them as recommendations to the
mm,
government. That's one of the ways that we've seen a shift. And just to also highlight some of the things that are happening as it relates to policy. In Nigeria, we've had startups work with government to develop the startups related policy. It skips my mind the name at this point. Sorry about that. But anyway, we've worked with government, and over time, what we found is that significant support have been provided to startups, and startups have also been able to attract significant investment following the setup of such policies. Currently, we're also looking at digital interoperability, and we're working, for example, with the Africa CDC and various other stakeholders in the space to design what the policy would be as it relates to digital interoperability across countries, but also working within countries to provide recommendations for how those policies can be drafted and what sort of standards needs to be adhered to within countries. And so a lot of the time, it's really not a one startup job, right? However, if you build a strong relationship like Eight Medical have done, with, for example, in Lagos State, you can actually try. If you can get the support that you need, you can work on policies together. At CCUP, for example, where I currently work, we've also at very early stage, some in the first 10 years in 2020, where connectivity was still a very critical challenge in Nigeria. We actually were involved in supporting in pushing for the government to allow for cables from main one to be set across Yaba. And the thinking was really to have some sort of Silicon Valley of Nigeria, a Silicon Valley version for Nigeria. And so that led to the improved connectivity in Yaba and the proliferation of startups and technology related organizations in Yaba that have remained till today because of the improved connectivity. And that's just one of the successes that we've had within that space. But definitely, governments are now interacting with startups through associations, independently as well, with startups that have actually shown significant impact to really think about their policies and ensure that they are fit for purpose. And so those will be some of the key things I'll mention as relates to that. The opportunity exists. There just needs to be strong collaborations within startups and innovators and actors working in this space. And in certain instances, you might need to really come together to provide policy recommendations and, work together to pass that on to government until such is passed, as part of the laws or regulations within your country. There's a lot of work involved there, but that's the work that needs to be done.
That's great. Thank you so much. There are no more questions in the chat box, but I think before we go forward, yes, if you would like to share your contact details, which is in the next slide. If you would like to connect with Stephanie and know more about her work or learn more about the health tech sector or would like to, gain her insights, please feel free to get in touch with her. You can see her email address in on the screen as well as her LinkedIn profile name. Please feel free to get in touch with her and she'll be more than happy to connect with you and network and respond to any queries that you might have. Stephanie, thank you so much for your brilliant presentation. It was really insightful and there have been some really positive feedback coming through in the chat box. But before we log off, do you have any final words to tell our audience today?
Right. One is just to, quickly highlight that the policy document I had referenced earlier is the Nigeria Startup Act from 2022, that has actually encouraged registrations for startups, attracted investments, etc., for startups. And, there are several other policies related to artificial intelligence, etc., that are also being put in place. And on a final note, I would say that there are opportunities in Africa to innovate, to disrupt market systems, processes within health and across several other social impact sectors. Opportunity exists, and I'd like to encourage those on the call today to leverage those opportunities where possible, to design for Africa and to build solutions that can actually help move the needle, improve lives, and also help you to sustain a viable business in Africa. It's the next big place for innovation, and I like to see that participants from this call actually participate in driving change and really building businesses, innovative tech innovation businesses for health in Africa. Thank you.